The number of confirmed influenza or flu cases in San Diego County climbed to 302 this week. Flu viruses are typically most active in our region at the end of January and beginning of February. Plus, county health officials warn of possible measles exposure in El Cajon and the surge of whooping cough cases. My guest, Dr. Ellen Rodarte with Sharp Rees-Stealy Medical Center, joins us with what to watch out for and prevention tips. And Dr. Rodarte, the two people who died of influenza this week were elderly women or elderly people. Who's most at risk for getting complications from the flu?
Well, the folks that are most at risk are the elderly, like folks in nursing homes, children less than age 2, anyone with a chronic illness like diabetes or chronic lung disease, and also actually Native Americans are at higher risk.
Just a genetic factor there?
Just genetically, yeah.
When do you know, a lot of people get the flu, of course, but it can be deadly. When do you know that it's time to really get some medical help?
Well, most people, if they get the flu and they're healthy, they will be able to take Tylenol, ibuprofen, rest, and stay at home. But I like to tell my patients, if you're one of those high-risk folks and you get a high fever, call me, let me know, because we do have an antiviral medicine that we can get on board within the first 2 or 3 days that will keep you from being hospitalized.
So high risk, not and maybe some more severe complications that it's not being taken care of, or just mostly high risk?
High risk. Here's the problem. The antiviral medicines we have, they work best if they're started within the first 2 or 3 days. So the important thing is that people who know they're high risk get in contact with their doctor within that time frame when they have a high fever so that we can get the medicine on board. Of course, if someone does have a complication, we give them the medicine, but it doesn't work as well.
If you don't get it right in that time frame.
If you don't get it right away.
Now let's move on to measles. Two San Diego siblings are thought to have got measles at Disneyland and didn't know it, came back to San Diego, went to El Cajon Mall December 29th, and it's thought they have exposed lots of people to this infection. What are the symptoms of measles and how contagious is it?
So measles is actually very contagious, but the important things to remember are two. One, if you've been immunized, you're protected. Our immunization for measles is wonderful, 97% effective. So if your mother didn't refuse immunizations for you, you're going to be fine. The other thing is you'll know if you get measles because it's a high fever up to 104 and the rash from measles is very distinctive. So you're not going to miss it.
What are some of the complications as far as measles go and why is it dangerous?
So back in the 1960s or before the 1960s, before we had the MMR immunization, we had thousands and thousands of measles cases and hundreds of deaths in the United States every year. So measles can cause children to get very ill and die, but that's 1 in 300. The other 299 will be sick for 2 or 3 weeks and be at home, fever, achy type symptoms.
Okay. California has seen the highest number of whooping cough cases since 1958 this past year. What is whooping cough and why is it dangerous?
So whooping cough or pertussis is especially dangerous to newborn infants, and that is the population we most want to protect. But it also affects adults, and we call it the 100-day cough because it gives you a cough that doesn't go away for 100 days. And let me tell you, I've had adult patients with this. They're very unhappy.
Sure, you can't sleep. It's irritating. You're at work. Yeah.
And normal cough medicines don't work for pertussis like other viruses. So, but it is those young children that we want to protect.
Because they can die from,
yes,
they can
so
die from it.
Adults cough, babies just stop breathing.
Okay. Why are we seeing this resurgence in California and the U.S. from whooping cough, and what's being done to reverse that trend?
Well, what happened is we had a stronger vaccine, but it caused too many side effects. So we introduced the acellular pertussis vaccine. It works very well, but it's not 100%. So that is probably the main reason we're seeing a resurgence of pertussis, that our immunization, although it's wonderful at preventing deaths and it protects most people, there still is always a little bit of pertussis running around.
And most importantly, you're urging pregnant women to get this?
Yes, the most exciting thing that's happened recently is we figured out that if we immunize women in the 3rd trimester of their pregnancy, they pass protective antibodies onto their babies, and we are hoping that this will keep babies from dying. So if anyone out there is pregnant, just get immunized in that 3rd trimester and that will protect your baby.
Wow, a boost right before it's even born.
Exactly.
Dr. Ellen Rodarte Cartery, thank you so much for the update.
Thank you.